Harvard taught me to be a scientist. It taught me statistics. It taught me how to think about science, review it critically, and use it to advance. I grew up in Hyde Park. It had an enormous influence on my interest in public health. The people around me I saw as individuals who were trying hard, but most of them were succumbing to preventable diseases. I saw people dying in their 50s, and even as a young person, it seemed, why is this happening? My parents, neither of them were able to finish high school, but they instilled in my brother, sister, and I the importance of education. I trained in internal medicine, but I knew if I wanted to do work in prevention, I had to learn more about being a scientist. That got me interested in big issues like smoking, and that's how I began to devote my career to that.
I met Dr. Fiore decades ago. I got to be eyewitness to this meteoric rise that Mike has had through his career, so that today he is the acclaimed leading tobacco cessation expert in the world. When you go to the doctor's office now, your doctor will also ask routinely, do you use tobacco? That didn't used to be the case. If you ever hear that question, think of Dr. Mike Fiore. He made that happen. He is perhaps the single person who helped start the National Quit Line Network some 20 years ago. So if you call 1-800-QUIT now, 24/7, somebody will pick up the phone and give you the best possible advice, free of charge. Mike has saved more lives than just about anybody in our generation of healthcare and public health professionals.
We've gone from adult smoking at 45% of all people back in the early 60s to only 10% of adults in America smoke today. It's an extraordinary public health achievement, but we're not done. People don't realize it, but if you're a smoker and you get diagnosed with cancer, your likelihood of surviving that cancer is highly determined by whether you quit or not. I would love before I die to see tobacco use eliminated from America, and I think it could happen. In fact, when we talk to American smokers, 70% of them say they want to quit, and the current environment is not supporting that, but there are so many people committed to it that I think we'll continue to make progress.
Mike has gained this worldwide reputation, published 300 plus articles in the top journals in the world, won over $200 million in research grants, founded a nationally leading center. He's the most humble person I think I know. But more than anything, he wants to see that research applied to help people and eliminate suffering, save lives, and bring hope for the future.
I love the work I do. It's an incredible privilege. My experience at Harvard has allowed me to help the community from where I came and the community to which I'm devoted to making a difference.